Hey everybody, Karen O'Donnell from Imperfect EFT. Thank you for joining me. Today is going to be a special stress reduction for nurses, and in future videos I will do other healthcare workers, but being a nurse for many years, I know what it feels like to have the stress of the job, and especially working in a department that I do, the emergency department. Things can sometimes feel very overwhelming, and there are so many different specialties of nursing that people experience, from maternity to school nursing to med surg, ICU. There are so many different types of nurses, and we all have our own stress when it comes to taking care of other people. And today's video is about being able to reduce that and to feel better about the care that we give our loved ones and other people's loved ones. So thank you for joining me. And again, today we're going to be talking about stress reduction for nurses, and we're going to be using EFT. So just to recap what EFT is, it's the emotional freedom technique, which is tapping very gently with your hands, your fingers, on different acupressure points, and it helps to reduce the amygdala response of your fight or flight, so that when you're in a heated, situation, if you're feeling out of control, if you're feeling overwhelmed at your assignment, or somebody who's belittling you, or whatever the situation is while you're working as a nurse to try to take care of people the best you can. This is a very quick technique that you can use, even, just going to the bathroom and doing this for like a minute or two. So this is great that you're joining me, and I thank you for that. So when you're in that situation, whatever it is, if you can just start and think about where it is that you feel that discomfort. Are you feeling it in your head? Is it your whole body feels overwhelmed? Whatever the sensation is, you want to think about that and what it's going to feel afterwards. So let's talk about right now, if you were to think about something that happened recently that really makes you angry and it triggers you so that you start to get that panicked anxiety feeling. Think about that and where you feel it and what that 0 to 10 scale would be, 10 being like the most distressing that you feel just thinking about that situation. And you want to write that down so that you know what the change is going to be after we do our tapping. So we're going to start by using our side of the hand as we have in the past, and it doesn't matter if you use your right or left hand. You're just going to gently tap on the side. So our setup statement is going to be, even though I have the stress for taking care of others, or you can change it to, even though this stressful situation that I had this week, whatever the issue is, you can change it. And then you're going to say, I accept that's how I feel right now. So next time, let's do, even though there was this really stressful situation while I was at work, I accept that's how I'm feeling right now. And then we're going to do it a third time. Even though I had this really stressful situation at work, I accept that's how I feel right now. So then we're going to start at the in between the eyebrows. And we're going to say, this stressful situation that I experienced. On the side of the eye, this stressful experience that I had at work. Under the eye, this stress that I was feeling about this situation. Under the nose, this stress that I was feeling while I was at work. Under the lower lip, this stress that I feel in my body. Right on the chest area, right below the clavicle, the stress that I'm feeling about this situation. Under the arm, this stress that I was feeling about this situation. On top of the head, the stress that I was feeling about this situation. So that was one round. I think we should continue though, because it was probably very traumatizing for you. So let's just keep going. Right in between the eyebrows again, we're going to say the stress that I was feeling about that situation. On the side of the eye, it is really stressing me out. Under the eye, the stress that I was feeling during this situation. Under the nose, the stress that I was feeling during this situation. Under the lower lip, the stress that I was feeling this week. On the chest, the stress that I was feeling, I'm still feeling. Under the arm, but it is safe to let this feeling go. And on top of the head, the stress that I was feeling, I want to let go. You're going to take a deep breath and let it go. And if you can note where you're feeling that sensation again, whether or not it is shifted. If it's really something that was bothering you, you may notice that it only shifted a little bit. So I would encourage you to do 1 or 2 more rounds of tapping to see if we could reduce it some more. But we're gonna, as always, end on our 3rd round. I'm gonna try to change that a little bit so that you can truly release it from your body, and future experiences that you have, you'll be able to more calmly combat them so that you aren't as reactive and not as stressed during those experiences. So let's start at the eyebrow point again, and I'm going to say the stress that I was feeling about this situation. On the side of the eye, the stress that I was feeling, it is safe to feel it, but it's safe to let it go. Under the eye, it is okay to let this feeling go. Under the nose, it is safe to let this feeling go. Under the lower lip, it is safe to let this feeling go. On the chest, my body can let this sensation go. Under the arm, my body is letting this sensation go. Top of the head, my body is letting this sensation go. Take a deep breath and let it go. So if you think about that event that happened that was really stressing you out before, you should notice that it is not making you as reactive. And that helps so that for future events that are causing you stress at work, you can more gradually, calmly assess the situation, and you won't be as reactive in terms of feeling that stress response. So this hopefully will help you with future events, as well as the event that happened that was really traumatizing for you. And especially as a nurse, you are trying to work the best that you can, take care of people the best that you can. But the best way to do that is to be able to take care of yourself so that those stressful situations aren't as stressful and you can react differently, so that, again, future events, you are able to take care of people as best you can. So I thank you for joining me, and if you can give me a comment on this video whether or not you feel that it was helpful, and if you can subscribe to the YouTube channel, that would be great. But please share this with other nursing colleagues, and again, I will be doing other videos in terms of, generally healthcare workers. I don't want to focus only on nursing because, we act as a team in healthcare, and taking care of people is a multidisciplinary team. So I'm going to be doing more videos on other disciplines, but I thank you for joining me, and I hope to see you next time. Thank you.